How many of us have clients that come in complaining of GERD, hiatal hernia possibly? I have had a lot of people over the years that have gastrointestinal problems and they don't know what they are. Sometimes they're diagnosed with a hiatal hernia. So what's a hiatal hernia? Hiatal hernia is when the esophagus pulls up through the diaphragm and forms a little stomach above. Simplified, that's a simplified version of it. So they've got two stomachs. There are different kinds of hernias. There's a sliding hernia where it goes back and forth through that because the diaphragm now has a little hole in it, a bigger hole in there. And so it allows the stomach to come up through. That's a bad thing because that hydrochloric acid starts putting a lot of compression in there and it pops up through the valve there, and it can cause Barrett syndrome, which is precancer and stuff like that because it gets hydrochloric acid on the esophagus. Esophageal sphincter. Okay, so for years, years ago, I started doing this hiatal hernia technique on myself. Coming in at the xiphoid process, however you want to pronounce it, right there in the middle, a little bump. Look right here, I put a little bit of a dot right on her xiphoid process. Okay, so we don't want to be on that, do we? That's bone, cartilage, bone, whatever. We want to be on this side, the left side only. Why? Why the left side? Because the stomach comes down like this and comes over to the side. So the neck of the stomach is like this. So we want to hook that neck of the stomach, and everybody that's taking visceral work is going to go, you can't hook the neck of the stomach because you have all this tissue to go through. Granted, you're right, but all that tissue is connected fascially, right? So you're dragging it down indirectly, right? All right, so this is a fabulous technique. First of all, though, the vagus nerve. It's a very popular subject for people to talk about, and if you look at the way the vagus nerve traverses through the diaphragm down through on the esophagus through the diaphragm, it actually comes on all sides. It has branches coming on all sides of the esophagus. So one day I'm thinking, wait a minute, I wonder if that constricture in the diaphragm is compressing the vagus nerve, causing some of these problems. And so a whole different mindset occurred to me, and then after I started experimenting with clients, I realized, yep, that a lot of people do not have that stiffness. I'm not feeling anything coming down, but they're feeling a release, and they're telling me that their GERD gets better. You know what GERD is? Gastrointestinal reflux disease. So anyway, we're going to do this technique. I'm going to stand kind of on an oblique angle, take my fingers, pointed back toward me, and come in on the xiphoid process with a couple of fingers. Just roll your fingers gently over that little bump. Some people do not have that little bump, so don't worry about it. If they don't, just come over to the left side of the costal rib cage. Follow that costal rib cage around there. That's why I have this line here, drawn sloppily along there, is to show you kind of the direction that I'm going along the costal cage. But we're starting way up here, and the key is on this is you've got to be as high up as you can. In other words, when you're right beside that xiphoid process, get way up high on it. In other words, see that my index finger is way up there on it? That way you can get a grip and push it down. It's your best mechanical advantage to start hooking the fascia that connects to the neck of the stomach to allow you to kind of drag all that stuff down. I'm going to put my left hand on her forehead. You can put it anywhere you want. And I'm just going to start putting a slow, gentle pressure, making sure you're checking in with your client, patient on the table. How you doing? It's bothering you, not too much pressure, everything's groovy, we're cool. Here we go, down. And I just go until I feel like I might meet a restrictive barrier. Right now I'm going pretty much toward the table, kind of obliquely, but pretty much toward the table right now, until I feel like I got a little bit of a fascial hook. Sometimes it takes a while to get down there, but I think I've got a good enough hook that I'm now going to change my direction a little bit. I'm going to rotate around here, and I'm going toward the left ASIS, anterior superior iliac spine. So I'm going that direction now, but still toward the table, and I'm just kind of dragging that tissue down. Sometimes you're going to feel a gurgling. That typically is when they truly have a hiatal hernia, particularly a sliding hiatal hernia. It'll start gurgling because all of a sudden that little stomach above starts to drop all the contents down into the regular stomach, and that's when you're hitting gold. Everything is going good. All right, so this is really all there is to it. You just keep that constant pressure down there, and you'll feel it. Just follow the release. It's just a kind of a myofascial release. Just follow that release down, and you can kind of tell because the stomach will eventually, it'll just settle. The tissue will quit pushing back against you. Right now I'm feeling her kind of push back against me and relax, push back against me. Pretty soon it'll just kind of calm down. That's when you're done. Okay, I'm going to come out real slowly. When you're in, I'm a lot deeper than it looks. You have to come out layer by layer slowly. Anytime you're in the body, you got to come out really, really slowly. You can bruise people, you can cause all kinds of stuff. All right, so the other one is a technique that an old chiropractor taught the second chiropractic college in the United States, Carver College in Oklahoma City, taught me this about 30 years ago, and this is how some of the chiropractors do it. It's not as specific, and I don't like it quite as well as my version, but it's still pretty good. We're using our thenar eminence in here, and we're just going to come in like this. Got the V because you got right in between the two costal cartilages there. And I'm just going to first put a pressure pretty much toward the table, but I'm also dragging down, but I'm waiting until I get a hook. Now, can you do a slow pelvic tilt? In other words, push your back toward the table and then rock your hips back and forth a little bit? Perfect, perfect. That helps me get a little bit of movement through there and kind of feel more what I'm doing. So I'm dragging this all down. This feels really good. I just love to have this done to me. I've had problems with GERD and some of those things before, and this has been a big relief to me, and I've learned how to do it on myself, and it takes a while to learn that because of the finger positioning, but you can learn it on yourself. Just try it. Okay, slowly come out. Layer by layer, by layer, by layer, by layer, by layer. And that's it. Give that a try.